Dear colleagues, this is an unedited Phaco. This is a 2.8 millimeter incision, and after this incision there is no leakage of aqueous humor. I support the eyeball with a cotton tipped bud and don't use any toothed forceps to fix the eyeball. That's it. The incisions have been made. Now this is air bubble, and underneath this air bubble trypan blue dye is injected to stain the anterior capsule. Little bit of adrenaline is also injected to see if the pupil dilates little more, and in this case it worked. It dilated quite well after adrenaline. The dye is then washed out. Now 2% HPMC is injected into the anterior chamber, and now is the time to do capsulorhexis. A 26 gauge bent needle is introduced through the right side port, and the capsule is incised and a nice flap is raised. A Utrata forceps is used to hold this flap, go anti-clockwise, and do a nice round rhexis. That's it. The rhexis is done. This is a fairly round rhexis of optimum size. Now see the hydrodissection. Fluid wave goes to the other side. Hydrodelineation is also done. That's it. Hydrodissection and hydrodelineation is completed. Now we see that the nucleus rotates nicely. And now is the time to introduce the tip of the Phaco handpiece. 2% HPMC is injected again. The machine being used is Oatley Catarix 3 Phaco machine. And since this cataract is quite hard, nuclear sclerosis may be about grade 4, I am using a technique which I call Submarine Chop. The tip is totally buried into the substance of the nucleus, and as a submarine moves underwater, this tip will move through the nucleus, totally buried in the nucleus like this. It's totally buried, moves towards the opposite equator, and it is chopped like this. See how beautifully you can divide the nucleus. Now I rotate it 180 degree and divide the nucleus into two halves. One heminucleus has been divided again into three parts, and it is emulsified and taken out. From the very beginning I am in Phaco 2 mode. In Phaco 2 mode, in this case the power is 75%, flow rate is 45 ml per minute, and vacuum is 450 mm of mercury. This is the other heminucleus. It is chopped into two parts, and each part is emulsified and removed. This is a totally unedited video, and you can see each and every step of the surgery. This is the last fragment of the nucleus. It is again divided into two halves. I remove the chopper to make the antechamber more stable, and I remain at the center, and the pieces come at the tip and it is removed. I didn't reduce the vacuum or flow rate, but beginners should reduce the flow rate and vacuum. They can even come back to Phaco on mode and emulsify the last piece of nucleus. Now after injecting a little bit of viscoelastic substance, this cortical matter is removed. A 23 gauge Simcoe cannula is being used to remove these cortical matter. A small nuclear fragment is seen. We must remove it. We must not let it get lost underneath the iris somewhere. It has so happened in my practice that after 1 or 2 months, patient has come with a nuclear piece settled at 6 o'clock antechamber angle and overlying corneal endothelium is damaged. So we must remove all nuclear fragments. And in this case, I am polishing the posterior capsule using the jet of irrigating fluid. Yes, it can be called hydro polish. Hydro means water. Since you are using a jet of water to polish the posterior capsule, you can call it hydro polish. Now this loose cortex is removed. The aspirating is from the right side and this loose cortical matter is now removed. That's it. Nice polishing has been done. Now I am enlarging the main incision a little bit with the keratome because the cartridge is a large one and the lens is being implanted, keeping the antechamber formed by irrigation, and the irrigating probe places the lens in the capsular bag. Now a quick wash of the capsular bag and the antechamber is given, and that's it. The case is done. This is a little bit of moxifloxacin. Now these side ports are hydrated to make these paracentesis incisions waterproof. I don't usually hydrate the main incision. It doesn't require hydration in 99% of my cases. Now this is the final antechamber lavage to remove the viscoelastic substance from the corneal endothelium, and a final lavage of the capsular bag. Now the antechamber is formed and the case is concluded. So in this case you have seen submarine chop, how to make the incisions, how to make the eyeball stable just with the cotton tipped bud. You can devise your own techniques. Hope this video will give you some ideas. Thank you very much for your attention. Hope this video will help you in your practice.